any ethical things which you want to say with the future generations, that they can must have to follow these steps to have a longer run like you?
At all times, any treatment should be in the patient's best interests, not necessarily your interests, your financial interests, or any prejudice you might have. Just apply your well-known principles, apply evidence-based principles. Think about what the patient needs rather than what the patient wants. Applying evidence-based principles into day-to-day clinical practice. So it's understanding the student's lot that helps an awful lot with teaching.
Any memorable moments which you can share from a long period of teaching experience? You can say like, yeah, this is the most memorable moment for me, for my students, and both of us. Like,
we often say that other teachers that I know, it's that light bulb moment when a student attaches importance to something that you're teaching at the time, or when they experience something for the first time. It's memorable for them.
so is there anything in your bucket list for the future, as you are serving to the dentistry, you want like, okay, still I have to do this for the future of dentist, or for yourself, or something like that you want to share?
Just continue working with the various organisations I work with. It's basically about setting and upholding standards, really.
How can you, like, this is, I know this is quite a hard question for you, but what's your career satisfaction which made you like, okay, now I'm done, and you decided to get retired from a clinical practice? What's the thing which made you like that?
I think I've been done for a long time. I have pretty much achieved everything that could be hoped to be achieved.
Any remember DA, or you wanted to share something about her? Like, I know about her, but I wish you can share about her experience and her journey. Dr. Shara, the pedodontist.
Sarah began here as an agency dental assistant. She had come under difficult circumstances from Iran.
Good afternoon, friends. Today we are with one of the renowned prosthodontists from Australia, Dr. John Boucher. As I promised you, we are going to have one more great guest in our Dent Innovation group. So today we welcome from the bottom of our heart and my fatherly figure, personality, one of the senior most prosthodontists, Dr. John Boucher. Good afternoon, Dr. John Boucher. How are you?
Afternoon, Martin. Thank you. I'm fine.
Last week you have retired last month. So what you are doing right now, and what's your progress, and what you are thinking for the future, sir?
Well, it's holiday time of year, so I still feel like I'm pretty much in holiday mode. Having said that, Tuesday, 2 days ago, I spent a session 9 hours online. We were looking at the content of the Australian Dental Council written exam coming up, verifying the quality of that exam. And I might say it's an excellent exam.
Wow. So let's start something about your career. So how do you find like you can be a dentist in early child, like when you are a kid? How do you think?
My only
Experience as a child was as a patient.
I guess I just fell in to dentistry. I didn't even think about a career until I was probably a few months off finishing my year 12. So yeah, it just happened.
So what made you like, okay, I can be a dentist, and what's the like a stone that we can say that which changed your life towards the dentistry, which molds you?
I guess it wasn't until early third year. Back then we did 5-year undergraduate course. And it wasn't until I got to use my hands and there was more practical and then clinical application of the didactic stuff that we'd learned in first and second year that I quite enjoyed that, and I enjoyed the fairly demanding requirements of creating things on a small scale.
So, you can remember any good incidents which you want to share from your college life or early childhood life, which inspire our people who can become a dentist, future generations?
I was unusual at my school in that in those days people only did 5 subjects at year 12. But I'd always had an interest in art, and I studied art without tuition, and I enjoyed that. And I guess I've applied that in my dental career, but I still have an interest in that.
Okay, so how many challenges are in dentistry at that time when you become a dentist? How challenging the field of dentistry, and what you can say, like, yeah, it's a big challenge at that time?
Yeah, I guess making a transition from your didactic knowledge to your clinical practice, you have to relate to people, and people put themselves into your care, and it's a leap of faith for them to trust your ability, particularly when you're a student.
So that's good. And what do you feel like teaching philosophy, and how do you find it? How you can say, like, yeah, because now you are also one of the teachers, and you teach many graduates. Now one of the renowned dentists of Australia, you teach them.
Look, I made some notes, and here we go. I did make some notes on teaching. You asked about how the digital era has affected dental education, and I think from a didactic point of view, dental education has been improved in the digital era. However, clinical and technical training remains the same as ever. The assessment of dentists in training and the delivery of teaching has changed. And I have notes here. And really, as a teacher, particularly a clinical teacher, I think it's important to understand what the student is going through. I can remember my days as a student very clearly, and they have some insecurity, they know that they're inexperienced, and it's helping them connect their knowledge with application of that knowledge into clinical practice, and applying evidence-based principles into day-to-day clinical practice. So it's understanding the student's lot that helps an awful lot.
Any memorable moments which you can share from a long period of teaching experience? You can say, like, yeah, this is the most memorable moment for me, for my students, and both of us. Like,
we often say that other teachers that I know, it's that light bulb moment when a student attaches importance to something that you're teaching at the time, or when they experience something for the first time. It's memorable for them, and they never forget that. And I found the same as I was a student and then practicing dentist. When you perform a procedure for the first time, it's memorable, and you can then apply that to a broad range of cases, and you become better.
okay. So John, I wanted to know about a little bit more about ethical dilemma, what we can say, because being student is a different thing, and when we have become a professional, it's a quite different thing. And the ethically, because nowadays people are not that much attached to ethics, which older dentists are most attached to that. So what's your dilemma, and how you come out of it, and how you can teach the future generations that they can come like a fresher dentist like me? How you will suggest us?
A couple of examples of ethical dilemmas. One of them, and I've only come across it a few times, but you may have a teenage patient and you observe fairly advanced enamel and sometimes dentine erosion, and you're pretty confident that this is due to an eating disorder or even bulimia. And then you need to protect that teenager's privacy, but how much should the parent know? And striking the right balance. I think if I was a parent, I think I'd like to know if the dentist expected that. But then you've got to balance that against the teenager's rights. So that's one. Another one that you come across much more commonly is when a patient presents having had either a short course of treatment or even a lengthy course of treatment and care from a colleague, another dentist. You owe the patient the truth. You need to present to the patient what you observe, but not necessarily be critical of the previous dentist's work or care, because you don't really know the circumstances under which that care was provided. So it's being fair to both sides, but you need to not overprotect the other dentist. You need to be very open and honest about what you observe.
That's really helped me. And any ethical things which you want to say with the future generations, that they must have to follow these steps to have a longer run like you have a huge vast experience in a like I can say academics and a private clinic. So any tips you can share ethical?
Just apply your well-known principles, apply evidence-based principles. Think about what the patient needs rather than what the patient wants. And at all times, any treatment should be in the patient's best interests, not necessarily your interests, your financial interests, or any prejudice you might have about the most appropriate treatment. So at first, it's the Hippocratic principle, first do no harm.
And you can share some like ethical as well as clinical aspect of your experience in a dental board, which you can say like I must share, which is like you can share.
Well, I had many years of, if you like, making assessments or even judgments on people practitioners who came before either Dental Practice Board of Victoria or the Dental Board of Australia. And I sat on hearings, and the main thing here is that every practitioner needs to be afforded procedural fairness. They need to be afforded natural justice, and often we would call upon expert opinion for a particular case. I have been privy to cases where the behaviour of the practitioner has been appalling, whether that be clinical standards or whether that be professional misconduct. I guess that's why regulatory bodies exist, mainly to protect the public from such conduct.
Yeah, that's I do agree that this experience will help us. So what's your look like a future of dentistry? How you can say as your experience in a dental board, what do you think like, okay, these are the acceptable? Because nowadays on social media and electronics media, people are promoting and giving some fake promotions also. So what's your view?
I think this is a multifactorial issue. Today's Australian graduates often graduate with significant debt. Their tuition fees, let's take for example Melbourne University, where it's a graduate entry course, and to gain entry, you need a 3-year undergraduate degree, and that comes with fees. You then have educating dentists is a very expensive proposition. It's costly, and often dentists can graduate with debts of $400,000 or $500,000. For overseas trained dentists who uproot themselves from their homeland, have the cost of travelling here, supporting themselves, and in some cases their family, while they're preparing to sit their registration examinations. And so people graduate and begin practice with a huge debt. And with that hanging over them, they need to earn a substantial living. And if their treatment planning decisions are driven by supporting that debt, then they're not necessarily going to make the best decisions in the interests of their patients. So that's an issue. You brought about social media. Often these representations by practitioners often give unrealistic expectations to their audience, which are potentially their patients. And oftentimes those expectations are not going to be fulfilled. And so this creates issues.
So how you suggest, like for the dentists like me who are coming from overseas and working here, any suggestions for the dentist? Because we seen the dentistry in a different level of learning and doing things, and after coming here and we are practicing in this country, what's your, as a academician, as a professional, as a dentist, what's your expectations from juniors like us to do the things?
Well, things like you've done, Wajid. Observing what Australian general dental practice looks like, and becoming part of that, getting to know what's important in our dental service delivery, and how that can be done in a way that satisfies patients' needs, and ends up with sound oral health.
So now this is one of the most curious questions for me I wanted to ask. How do you do a work-life balance? What's your mantras for like beginners like us? What's your mantra for work-life balance? How we can manage like family and work both?
I think I'm a fairly poor example of work-life balance. Certainly in times gone by, work was the major part of my life, and taking on outside commitments just made that more difficult. But it was something I always enjoyed. Outside of dentistry, I've got a few interests. I'm certainly interested in running. I've been a runner all my life. I used to compete until I was about 40. But it's a good social thing to do as well. So that's one thing. Another thing that I've been very keen on, perhaps over the last 15 or 20 years, is outdoor cooking, barbecue, particularly American barbecue, and it's something you need a lot of time for, but I'm looking forward to being able to do that a bit more in retirement. The other things, of course, I have a classic car that I enjoy driving and maintaining. And more recently, family is all the more important with now having 4 grandchildren, and watching them grow and develop is something that I'm looking forward to.
I wish you can share something about Rhonda also. So I wanted to make sure our users that Rhonda is John's wife, and she is also worked with John, and she's a partner of John also in clinic too. So I wish you can share some experience from both of your life and how you manage as a partners.
Well, being a dental assistant, Rhonda has spent over 40 years as a surgical assistant in oral and maxillofacial surgery. And so that gives her a good background. We've each been involved in overseas voluntary dentistry too. Between us, we've made 8 trips to Vietnam to provide basic primary dental for school-aged children. We've spent something like 12 or 13 weeks in Vietnam altogether. So that was something we relate to. But Rhonda's been great support on the home front, and while I'm working long hours here, Rhonda has always been looking after the family and taking care of that. And I hope to improve that balance in the next little while.
I must say Rhonda is really great person, because since last 1 year I have seen her, like she's managing your son's kid and all the grandkids here and there. She's going to their house, she's keeping them at home and taking care of everything. So it's really great personality you got, I must say. So any funny anecdote you wanted to share with us?
There's many from long time past. In the very early days of the Australian Dental Council clinical examinations, it was very different. It was a 6-day exam, and we used to give many Viva Voce exams through the course of those 6 days. And one of the guys I used to examine with, we enjoyed creating a challenge for each of the candidates. And one of the role play things that I would do, if I found a candidate wasn't committing to a particular course of action for a treatment plan, I would say, look, this is very important. Let's say this patient is your mother. What would you do that is in your mother's best interest? What treatment plan's best? And they'd give me a particular answer. And then for fun, I would say, okay, but what if this was your mother-in-law? And often the candidates didn't get that joke, but my colleague and I had to control ourselves from outward laughter. But that was a bit mischievous of me to do that in a very serious setting. Other than that, incidents come up, there's laughs, but basically general practice is a fairly serious situation, and I think we owe it to our patients to remain focused on the tasks at hand.
Any tips you wanted to share with the ongoing Australian Dental Council exam students, like they can improve themselves or how to improve their confidence?
I guess familiarise yourself with the exam process, and there's no substitute for hard work in doing that, particularly for the written exam. Knowledge of dental practice will get you through. For the practical exam, again, familiarise yourself with the format of the exam. Understand that we're assessing all sorts of things. We're assessing technical skill, we're assessing communication, we're assessing your application of knowledge, much more so than straight knowledge. We're looking at your safety, and in the end, that's why we're doing these examinations, in the interests of the safety of the Australian public.
I agree. I learned a lot of the things from you, because initially I asked you, like, John, how can I learn about the Australian people and all, and you told me like, okay Wajid, you assist me, you will get to learn all the things. So I agree with you that how you can understand them, how you can answer them, how you can, and the way mostly I remember one words from you, it's cooking. After every anesthesia, it's cooked, it's cooking. The words you say, I learned that things, and that will help us like the thing. So is there anything in your bucket list for the future, as you are serving to the dentistry, you want like, okay, still I have to do this for the future of dentist, or for yourself, or something like that you want to share?
Just continue working with the various organisations I work with. It's basically about setting and upholding standards, really.
How can you, like, this is, I know this is quite a hard question for you, but what's your career satisfaction which made you like, okay, now I'm done, and you decided to get retired from a clinical practice? What's the thing which made you like that?
I think I've been done for a long time. I have pretty much achieved everything that could be hoped to be achieved. But beyond that, no. It just came to a time when I thought retirement was for me.
And is there any advice you can give your younger self, like, okay, John, if you are like now you are 22, 25 years and just freshly graduate, you can give any advice to yourself which you think, okay, somebody will give me at this age, I'll be more better?
I think it took me a little while to work this out, but if from the day of graduation you prepare yourself for continued lifelong learning, I think that is something that I didn't understand back then. A year or so in, I did understand that, and that's been very useful for my career.
And would you like to share any influencer in your life and any mentor whom you like? For me, you are the one, like you, I always like, no matter how far I go, I'll work in India or here, no matter where. But for me, you are the one who is inspirational and mentor for me. So, is there anyone who's in your life whom you can say, yeah, he influenced me or he mentored me?
Well, Ian Hansen, who started this very practice, he was my first influence, mentor after graduation. And then John Harcourt. John taught me how to teach. I still see John. John's in his 90s, and I really value John's teaching, and he's been a great colleague. More recent, well, not so recent, it's probably 25 years. Martin Tyus has been a great mentor for me. Martin's knowledge is never ending, and Martin continues today to amaze me with the ability to keep current with things. Yeah.
Because we discuss about Martin most of the time. With you said like, yeah, we go on this research and he was aware about this, he was aware about. So I have heard a lot about him. I wanted to meet him once. So how do you think like the people of future generation will remember you and your legacy? Like, what do you want to like be remembered?
I think, as I touched on before, establishing and maintaining standards. I think that's something that it's been a theme for me. I'd like to think that I've been capable in teaching, and that people I have taught remember the things that we've learned together. I think fairness, particularly in a regulatory sense, I think that's important. Ethics amongst colleagues and ethics towards patients. I think ethical practice is an important thing.
How to manage like ethics and financial things, because these both are like on a different aspect, and which leads sometimes to being unethical to many people. How to manage?
There's a saying, and I can't attribute it to anyone, but it's something that I repeat often, and that is, if you look after the patients, finances will look after themselves. So if you're consistent, if you deliver good care, eventually the finances will be fine. Don't be in too much of a hurry.
Yeah, that's true. So any now on a funny aspect, I wanted to ask any myth which you heard in a dentistry, because in India I have heard plenty of myth, and we have seen many experience and things which you have seen on YouTube, like Indian dentists.
I don't know if you've seen this on Facebook in recent times, but I've noticed a recurrent posting about Vicks Vapor Rub and how that will heal caries and it will reverse periodontal disease. That is clearly inaccurate. There are always special interest groups that feel, for whatever reason, that mainstream dental care is flawed. For example, fluoridation of the water supply, and that truly is a myth. It is the most efficient, cheapest public health measure that mankind has ever engaged in. Things like the anti-amalgamists. Amalgam remains a very safe treatment modality, even though its use is very much reduced today to what it was even 5, 10, 15 years ago. Yeah, they're strange, but it's something as professionals that we need to deal with.
I agree with that. Even many times I have heard, like in India, people are saying there are some people who can remove your tooth without local anesthesia, and I have seen them, and they are pulling out it like a mobile grade 3 tooth. They just pulling out, and they said we removed it without anesthesia. So that's their fear. So this is the last question of our conversation, and I really wanted to know. I know all our staff really wanted to know, if you are not a dentist, what you want to be. What's your dream when you are a teenage or a young?
Yeah, I'm not so sure. It might have been in a field where design was key to what it was that you did. I don't know that I've been a good architect or such. I don't know. I've enjoyed dentistry too much. I've just been well suited to it. I like the discipline that pilots go through. They apply knowledge for the safety of the public. I think that's pretty similar principles to what we use. And maybe I could have been a physician again that applies knowledge to individuals and requires a lot of intuition and being at one with your patients, understanding patients, but dentistry's been too good.
And this is my personal question which I'm going to ask. So after 100 years, like this is the video content, so I know it will be longer lasting. So after 100 years, you wanted to give the message to your kids, like kids of kids. What will be your message as a person?
I don't know how to answer that, Wajid. I'm not sure. I think it starts with being true to yourself. It would recognize the value of hard, consistent work, the value of knowledge, and understanding your place in the world and contributing to broader well-being of people. But understanding yourself starts with that.
Any remember day, or you wanted to share something about her? Like I know about her, but I wish you can share about her experience and her journey. Dr. Shara, the pedodontist.
Sarah began here as an agency dental assistant. She had come under difficult circumstances from Iran, where the political situation there was difficult. Her brother had preceded her in Australia. She was a graduate of Tehran University, which I understand is a very good university in a dental sense. It was a 6-year undergraduate course. She prepared for her Australian Dental Council written exam, passed at first attempt, and then had 3 attempts at the clinical exam and passed them. She worked in this practice as a general dentist. She then had an attempt at entering specialist training at Melbourne University and didn't make it. She passed her Royal Australasian College of Dental Surgeons primary exam at the first attempt, and then gained entry into Doctor of Clinical Dentistry, 3-year specialist training in paediatric dentistry, and has been practicing as a paediatric dentist for about 3 years and is become very successful.
So here we are done. I would love to thank especially Dr. Ron, Dr. Priya and Dr. Freddy for providing this support, and all these staff from the Diamond Valley Dental Group. They supported us to make this possible, and heartily thanks to Dr. John who spared his time with us and share his memorable moments with us. Thank you so much, John, and
You're welcome.
we wish you a great life ahead, and we'll be in touch.
Thank you, Wajid.